It's okay, listen.
Hey, Ari, how you doing?
I got a breath.
I was trying to get me a little exercise in. Because, you know, I'm a female, and the older I get closer to the osteoporosis age. So I'm trying to do some little preventative methods, keep these bones in shape. How about you? It's the decay of the bones. You know, we start shrinking and getting a little bit shorter. And my grandmother, she's a little older and she has a hunchback, so I think it's a little bit genetic. So I'm just trying to do some preventative methods.
You know what, my grandpa, he has like a hunchback too. Maybe it might run in the family, I could probably have that.
It might be, because it is genetic in some cases. But you know what, you should go to the doctor. They do have a bone density test that you can take.
I appreciate it. I'm gonna go and look into it.
All right, you going to work out with me?
Yeah, let's go.
Come on, let's go.
That's right here.
Thank you.
Everything okay?
I just hurt my hip. I was running and I fell and I think I might have fractured my hip.
Oh, wow. That's interesting because based on your age, that's a very dangerous thing to happen, because what happens is that when someone is as old as you, about 60, your bone is actually breaking down faster than it's actually forming, and that can lead to that's what osteoporosis is.
What is osteoporosis?
Well, osteoporosis is basically when there's an imbalance between bone formation, new bone formation, and old bone resorption, when the old bone is breaking down to make new bone.
Wow, okay, so what can I do to help this problem?
Well, the doctor will have more information about that, because she can tell you what the treatments are. And, yeah.
Sounds good, thank you.
Okay. All right, so I'm going to go ahead and call the doctor, and she'll tell you more about the treatments and everything. Okay.
Hello, Mr. Cruz.
Yes ma'am, how you doing?
Hi, I'm Dr. Jenny. My nurse told me that you broke your hip. Is that correct? It seems that you have symptoms of osteoporosis.
Okay, he was explaining that to me.
Yeah, and he explained what osteoporosis is to you?
Yes ma'am.
Alright, well, I'm going to give you some treatment options.
Okay, good.
The first thing that I want you to consider is to change your habits and lifestyle. And considering your age, have you been going out in the sun? Have you been eating a lot of foods rich in calcium?
No, I haven't actually.
Well, that's one thing that you need to consider. You want to take in a lot of calcium-rich foods that are also low in saturated fats, such as low-fat milk, yogurt, broccoli, cauliflower, salmon, tofu, and leafy green vegetables. Those are all very rich in calcium. And you should definitely go out in the sun more. You should try to be outside, because sun exposure will help your body produce vitamin D, which is very important in calcium absorption. If you don't go out in the sun a lot, you might want to consider taking a supplement. And you also want to avoid a lot of phosphorus-rich foods, such as red meat. Do you eat red meat a lot?
Yes, I do.
That might be a cause, because phosphorus-rich foods will inhibit calcium absorption. You want to stay away from too much red meat. Also, soft drinks, foods with preservatives, those are all very high in calcium, phosphorus. And do you smoke by any chance? Smoke, drink?
I smoke a pack a day.
You see, that's all interfering with your calcium in your bone. And what it does is that it inhibits the absorption of calcium, and your body will start breaking down the bone as a result. So you want to avoid caffeine, alcohol, smoking. And you also want to exercise daily. Do you do that?
Somewhat.
Somewhat? Alright. Well, I want you to do these exercises 3 to 4 times a week, 30 to 45 minutes, and you want to do weight-bearing exercises and resistant exercises.
Okay, doctor.
So things like walking, hiking, jogging, and climbing stairs, weightlifting, those are all things that you should be doing at least a couple days a week.
Okay.
Alright, and if you still show signs of osteoporosis and your bone breaking down after this, I can prescribe you medications that help with. There's 2 types of medications. One is a anti-resorptive medication, which slows the bone loss in your body. Another is bone-forming medications, which helps increase bone mass. So it's actually building bone. And anti-resorptive is going to be something like biphosphonates, which are pills that you can take that act directly on your bone structure. And a bone-forming medication I can prescribe is synthetic parathyroid hormone. And what the parathyroid hormone does It stimulates new formation of bone in the spine and hip, and it reduces the risk of fractures, such as the one that you have. And it's a shot taken daily for 24 months. But these medications, don't rely on them first. I want you to first focus on your diet and exercise.
Okay.
All right? And you might want to also consider taking a supplement. It's called strontium ranelate, and it's a compound that decreases the risk of breaking a bone. So all of these are all options that you can consider to, manage and treat your osteoporosis.
Thank you.
Of course, anytime.
Hi, my name is Mohsen Sharif, and I'll be talking about the etiology of osteoporosis. Osteoporosis is the imbalance between old bone resorption and new bone formation. There is no known cause for this disease, osteoporosis, but there are numerous factors that can increase the likelihood of this disease, osteoporosis. The first category we're going to talk about that increases the risk and likelihood of osteoporosis are unchangeable risks. There are 4 things that fall into this category. The first one being sex. Female are more likely to get osteoporosis or develop osteoporosis than male. We are going to talk about this and go in depth in the second category. The second thing in this category is age. So as an individual tends to become older, what happens is that they're losing their bone mass. The reason why they're losing their bone mass is because their old bone resorption is exceeding their new bone formation. The third thing in this category is race. There have been numerous studies stating that South Asian women and Caucasian women are more likely to develop this disease, osteoporosis. And it has been proven that the majority of women that have this disease are either from South Asia or of ethnicity of the Caucasian. The fourth thing in this category, the last thing also, is called the body framework size. So when an individual is very small in size, their bones are actually small as well. So they're not allowed to reach the highest peak level, the peak bone mass, so they don't have high bone peak mass. So once they start to become older, they can get osteoporosis because they don't have that much bone mass and they lose it faster than other normal individuals. The second category we're going to talk about is the imbalance of hormones. Which hormones lead to, the imbalance of which hormones can lead to the increased risk and increased likelihood of osteoporosis. The first hormone we're going to talk about is estrogen. Estrogen is very important in bone formation. Early in puberty, estrogen helps bone formation very much. And when an individual or one female starts to become older, they start to decrease the levels of estrogen in their body. So as I said earlier, the female tend to get osteoporosis or to develop osteoporosis before and more than men is because of this, because estrogen levels are decreased in women. And testosterone levels, the second thing in this category, testosterone. Men do lose testosterone when they age, but they don't lose it as fast as women lose estrogen. So women suffer from osteoporosis more because they decrease the levels of estrogen faster than men decrease the levels of testosterone. The third and fourth hormone are thyroid and parathyroid hormones. These hormones regulate metabolism and also calcium levels. When there's an increase in both of these hormones, what happens is that there's a disturbance in the calcium levels in the bones. What happens is that the calcium in the bone starts to leave and starts to enter the blood. When an individual needs calcium in the bones, it's still going to go to the blood because these hormones are their function is to get to trigger that response. So an increase in these hormones can increase the likelihood of osteoporosis. The last hormone I'm going to discuss in this category is called cortisol. Cortisol is is a hormone which is triggered by depression and stress. What this hormone does is that it suppresses the sex hormones, and it suppresses the production of these sex hormones. And sex hormones, as we talked earlier, testosterone and estrogen, are important for bone formation, and they're important to keep the bone. They're important in that cycle of bone renewal. The third category I'm going to talk about is calcium intake. Calcium intake is key because our bones need calcium. Some things that can lead to an individual not getting enough calcium is if they are picky eaters and if they have eating disorders. So if an individual doesn't like to eat something that contains calcium, their body will not receive enough calcium, and picky eaters don't eat what they don't want to eat. So if they don't get enough calcium within their body, that can lead to osteoporosis because their bones are not receiving calcium the way they need to. Another thing that can fall into this category is if you have a stomach surgery. If you have in the stomach area, if they remove the part where calcium can be taken from the stomach, this can also affect. This also falls within this category and can lead to an increase in osteoporosis. The last category I'm going to talk about are bad habits that can lead and that can increase the risk of osteoporosis. There are many bad habits, but the most important three, the strongest habits that I thought would lead towards osteoporosis, and I did some research on and found were smoking, drinking, and lack of exercise. So smoking, what happens when you smoke is that it affects the body, the whole body, it does, but it also makes your bone weak. This is what the bones becoming weak can lead to osteoporosis. Excessive drinking can also lead to osteoporosis. Lack of exercise can also lead to osteoporosis because your bones need to have movement. An individual sitting in one particular spot and not doing anything will affect the bones, and this will eventually lead to bones being weak, and they can be fractured easily, and this can increase the risk of osteoporosis.
Hello, my name is Erica Bonds, and I will be presenting on the prognosis and symptoms of osteoporosis. The prognosis of osteoporosis is actually a good one because it is not a terminal disease. Osteoporosis is known as a silent disease because it's a disease that is onset throughout the lifespan. There are steps and measures that you can take throughout life to ensure a positive prognosis, which is a healthy food intake with calcium content will reduce the risk and the severity of the osteoporosis later on in life. Boys between the ages of 9 and 13 and girls 9 to 18 require a healthy diet of foods and calcium content as well as milk and vitamin D. Women older than 50 and men older than 70 require a higher calcium intake, which is normally through calcium supplements. Certain foods and drinks that are good throughout life to help ensure this is things like milk, fish, ice cream, broccoli, dairy products like cheese and spinach are loaded with calcium and vitamin D. With the symptoms, some of the symptoms I found were kind of tricky because, as I stated in the prognosis, it's a hard disease to detect until later on in life, which is mostly with the elderly, because that's when we start to lose some of the bone density. So some of the symptoms that I did find was over time you might experience poor strength of grip, receding gums, which happens because the teeth are connected to the jawbone, and that can be an indication of a breakdown in the jawbone bone density, and a loss of height, which can possibly be indications of onset of osteoporosis. But the disclaimer is they can also be warning signs for something else. Severe symptoms, which is what doctors mostly use to help detect osteoporosis, is by fractures or broken bones, such as the hip or the wrist in the elderly. Pain later on in age can be an indication of a change in the vertebrae, which could be small spinal fractures. These small spinal fractures go undetected because most of the elderly just feel like it's just a back pain. But what it is a breakdown of the bone density in the vertebrae, which can cause the elderly to develop a hunchback or kyphosis, which is the hunchback in the spine of the elderly. Once that occurs, normally that's when doctors will run a bone density test to determine osteoporosis has occurred.
Hello, I'm Mario Cruz, and I'll be talking about the current research on osteoporosis. Currently, there are 44 million women and men that suffer from osteoporosis in the U.S. alone. Worldwide, there are around 200 million people that suffer from osteoporosis. 55% are age 50 and older. This disease accounts for about 2 million broken bones per year. The people who get more affected are women. That's based on after menopause, estrogen gets declining, and estrogen is what helps keeps calcium in the bones. The current research is coming from all angles. You have preventive medicine. So examples might be people studying strength-based training. So you'll see titles like Intense Strength Training Benefits Post-Menopausal Women with Lone Bone Mass. That's just one example. You have people working in genetic mutation and factors. These are the more technical sciences and biologists. So one example might be role of genetic factors in the pathogenesis of osteoporosis. And then you have completely unorthodox people studying this disease from weird angles. One interesting research study I found was a group of scientists in Tokyo who were studying zebrafish because they have an extraordinary ability to regenerate osteoblast. And it's just amazing to see that all these different research scientists trying to study this disease that affects so many different people. Although they came from all angles, the majority of research stemmed around the two vitamins, vitamin D and calcium. So, as we know, vitamin D is what helps the body absorb calcium, and calcium is the building blocks of building bones. And one research study, it showed that 50% of elderly women with osteoporosis were found to have signs of vitamin D deficiencies who were hospitalized for hip fractures and who contain osteoporosis. In a later study, researchers found that a number of hip fractures were reduced by 43% when elderly women were supplemented with calcium and vitamin D. There's a bunch of examples that study vitamin D and calcium. There's even a big meta-analysis test that was conducted, and it included research trials in which calcium in combination with vitamin D were used to prevent fracture and osteoporostic bone loss. They found that overall there was a reduction of 12% of all fractures of all types. And you'll see a lot of research based around this and deficiencies. Some research studies include researching a part of a region of the world that have vitamin D deficiencies and trying to find a correlation with osteoporosis. So the good news is that there are multiple people from all over the world. Some of the brightest minds are researching osteoporosis from all different angles.
Hi, my name is Jenny, and today I'm going to be talking about treatment methods for osteoporosis. If you suffer from osteoporosis, first and foremost, your doctor may recommend that you seek treatment methods through diet and nutrition. You should make sure that you get enough calcium to build and maintain strong bones through calcium-rich foods that are also low in saturated fats, such as low-fat milk, broccoli, salmon, tofu, and leafy green vegetables. A lot of foods are also fortified with calcium, such as orange juice and breakfast cereals. You also want to make sure that your body is producing enough vitamin D to absorb calcium. Vitamin D is mainly produced from sun exposure. Most of the time, a small amount of sunlight each day will be an adequate amount to support calcium absorption. However, if you live in a location that sees little daylight, you may want to consider eating more vitamin D fortified foods or taking supplements. Avoid foods high in phosphorus as they can promote bone loss. High phosphorus foods include red meats, soft drinks, and foods with phosphate additives. You should also avoid caffeine and alcohol as they interfere with calcium absorption. Another bad habit to consider breaking is smoking. In many studies, it's found that women who smoke tend to have worse bone mineral density than those who don't. That makes you more likely to break a bone. Although bones may seem like hard and lifeless structures, bones are more like muscle. They are living tissue that respond to exercise by becoming stronger. Exercise improves bone health by strengthening the back and protecting the spine from fractures. And some safe exercises for osteoporosis include walking, hiking, jogging, climbing stairs, playing tennis, and weightlifting. Anything that involves weight-bearing or resistant exercise is a good exercise to include into your regimen, and you should perform them about 3 to 4 times a week, 30 to 45 minutes each day. Medications that can be prescribed to treat osteoporosis come in 2 categories: anti-resorptive medications and bone-forming medications. The anti-resorptive drugs slow the progression of bone loss, and bone-building drugs are agents that help increase bone mass. Anti-resorptives are more widely available, and they include medications like biphosphonates, which inhibit the body from breaking down bone by acting directly on the bone structure. Selective estrogen receptor modulators are another type of anti-resorptive that mimic estrogen in tissues and cause the body to retain bone mass. Hormone replacement therapy drugs prevent osteoporosis when taken during and after menopause in women by replacing the estrogen and progesterone that the body stops producing during menopause. Hormone replacement therapy is not prescribed often, and it's normally recommended to only high-risk women who have already tried other treatment methods. When you stop this therapy, it'll stop the treatment process, and the bone deterioration will revert back to the same pace as it was before the therapy was started. A type of bone-forming medication is synthetic parathyroid hormone, which is taken as a shot daily for 24 months. It stimulates new bone formation in both the spine and hip and reduces the risk of vertebral fractures. Another bone-forming aid is strontium ranelate, which is a supplement that, when taken, can help reduce the risk of broken bones. In general, it's very important to maintain a balanced diet that includes plenty of calcium and vitamin D to support strong bones, as well as proper function of the heart, the muscles, and nerves. Medications may help with the treatment process, but diet and exercise will play an immensely important role in both preventing and managing osteoporosis.